早晨，大家好，歡迎大家嚟。
Good morning, everyone. Welcome to our ICON Health Forum, which is conducted in Cantonese. The topic is Stroke Smart.
First, we do lend acknowledgement. We want to say that the UBC is located on the traditional, ancestral, and ceded territory of the Musqueam, and UBC operations are also on the territories of the Squamish and Tsleil-Waututh. We also like to acknowledge that you are joining us today from many places near and far, and acknowledge the traditional owners and caretakers of those lands.
我係何陳宇慈 Barbara Ho， 係一名註冊護士，亦都係安康健康網絡首席護理主任。今日咧，我係你大會嘅主持人。網上嘅朋友，大家好，歡迎大家嚟參加今日嘅安康線上中文講座嘅。呢個係誰有中風危機，應如何處理？
Now, simply put, I want to give you an introduction of ICON because some of you are first-timers. ICON is an initiative by the UBC Faculty of Medicine, the Digital Emergency Medicine, and the executive director is Kendall Ho. We've had this for 19 years. We also thank patients as partners, as our partners. We wanted to convey reliable and useful information to communities, to the indigenous citizens in BC, as well as family members and patients, provide them reliable and relevant health information on prevention and care of illnesses using technology so that they know how to manage, find technique to manage and lower the risks of having these illnesses. At the same time, we also will provide electronic apparatus, apps to the community to help them on improving health.
Today, we are fortunate to have so many professionals to talk to us about strokes and the effect and how they need to rehabilitate. Now, we are glad to have a caregiver. He's at home now caring for his wife. In September, unfortunately, she had a stroke, and this person is Pepin Wong. He is a retired RCMP officer. Thank you, Pepin, for being interviewed by us and have a discussion with us to share your experience as a caregiver. Thank you, Barbara. I don't know if you can hear me clearly. Very clear, yes. I have to thank ICON's invitation to share. Very simply, you don't know me, about my background, about what happened. Let me have a couple of minutes to tell you what happened. And I hope all the audience wish you a Happy New Year. In the stroke process and my personal experience in the past Christmas, it was different because my wife had a stroke in September. I clearly remember that evening was very sudden. She had her bath and she came out and she changed. She said, I got a very bad headache and kept vomiting. I helped her to bed. I wanted to get her some warm water to let her rest. But very soon she lost her consciousness, no more reaction. So I was in this very panicky situation. I use clear her airway and I called 911 for help. the professional came, medic came quickly. They drove my wife to Surrey Chinese Memorial Hospital. The leader told me it was dangerous, very complicated. If anything happens, what do you want us to do? When I heard it, I was shocked. My wife had enjoyed good health, and she wasn't that old. She was in her 60s. So I said, you try your best to save her. So the team members understood. They brought her to the hospital. I went in the same ambulance. I sat in there. Apart from being nervous and shocked, because of my religious belief, I kept praying. The male driver knew that knew my situation and kept encouraging me. But after a while, the fear service, why did it happen like this? Because of this, my wife is unable to be saved. But I've been married 47 years. What should I do?
Other than those issues, because there was religious support, so I was able to compose myself, and I also told my daughter and son-in-law I told them to contact me at the emergency ward. And when we were at the emergency ward, she was diagnosed of having had a stroke. So she was transferred to the Royal Columbian Hospital, and then she had a surgery on the next day. It seemed like the area of the stroke was on the left side of her brain, inside the brain. So she was unconscious for 14 days in the ICU, which got me very worried. So I had a lot of mental struggles, like what if she would not recover? She would become a vegetable. So because I had a friend who had the same experience in Toronto, so even after she recovers, her quality of life will drastically lower, and she may consider suicide too. Should we have arranged for these resuscitation process? We went that way because we have religious beliefs, but after she came to, after 14 days, so we have support from the church members. We also had a professional team who kept encouraging us and explaining things to us. For example, ICON, there was a professional team who supported us. So now Esther can stand on her own, and then she has regained her life, for which I'm very grateful. But I was just thinking to myself, during the recovery process, there was a lot of time that, because after she was unconscious for those 14 days, 24/7, at least 16 hours a day, I was with her. I was on her bedside. I was by her bedside. So my physical strength could not support me for that long. So not long ago, I had kidney stones. So fortunately, I had a surgery, and now I have recovered. And so in these events, over a short period of three months, it was a period of trial and tribulation. So thank you for the platform that we have here. We can share our experiences. And Barbara, you will send us some questions, or shall I directly answer them? We will broadcast those questions. Thank you, Pepin, for sharing the experience, because it happened so suddenly. So you were just perplexed. The family members didn't know what to do, and then you then thought about what was going to happen afterwards. So just like what you said, even in the ambulance, you were already thinking, what will happen? What should I do? Something I did wrong? Something I didn't do enough? So there were all these psychological inner struggles you had in mind. So let me ask you, now your family has, now that a family member has had a stroke, what kind of changes have you undergone? So drastic changes, because it was unexpected. So if something like that should happen, first of all, you should consider the caregivers' physical and mental health, because whether it's your spouse or your children or anyone cannot support you for that long. I mean, maximum 18 months. After 18 months, you're going to collapse. So within those 3 months, I experienced physical changes myself. So accept any kind of support, any kind of help, and even take the initiative to ask people for help. And I appreciated the medical team who gave us all these valuable opinions, and home caregiver. I think there's a government program. There's a mechanism. Yeah, there's this kind of service. You can have 30 hours of homemaker. Of course, you have to pay for it. But so I have signed a contract with a homemaker who comes to help me, and that has been very helpful. And also it has also helped your day-to-day routine, so that you and your wife can have time to focus on the recovery, on your plan of recovery, or what else you have to do on the road to recovery, and also adequate rest, and not having to worry about every single detail in your day-to-day life. And so what kind of people did you contact in order to find out that there were such services available? Yes, during the hospital. The hospital has arranged for some a care center for 3 weeks of therapy. It was very effective. Obviously, it helped my wife. And afterwards, we came home. I think only 3 weeks earlier, we had gone home. And the rehab center at Surrey also contacted us, and she started going to outpatient therapy. Yeah, so she started that with also speech language therapy. Yeah, right, speech language pathologist. Yeah, so we don't have a lot of medical knowledge, but so I'm very thankful for the help from many professional caregivers. At least they helped me and my wife to go to rehab. So it has been very helpful. So don't ever lose any opportunity. Don't ever give up. So yeah, we want to encourage everyone, because there are all kinds of organizations, all kinds of services that can help the patients and their family members. Now, as a caregiver, this is a second question. What has been the most challenging part? And how did you cope with that? Well, like I said, we had I had a lot of fear, and Dr. Young has explained just now. I mean, you have to understand yourself, understand yourself more, so that you can also help the patient, so that both of you can face life together, face reality together. Finally, are there any suggestions, or do you have any kind of encouragement for other caregivers? After what I've experienced, thinking back, you have to be confident. So you have to be confident. So religious beliefs helped me a lot, gave me a lot of support. Also through religious organizations, it gave me a concrete care. I'll give you an example. During her time of hospitalization, we had what we call tender loving care meals, which helped us a lot. Thank you for taking your time to share your experience today and instill more confidence for those people who are caring for their family members or friends who have survived a stroke. All of those, everything, there's always hope in life. In the community, in the hospital, there's a lot of support, lots of help. And if you need it, don't be afraid to reach out and ask. The more you ask, the more you will know about yourself, what kind of services there are to help you, so that you can feel comfortable to get treatment at home and rest. So thank you again, Pepin, for coming here personally to share with us your experience. I hope that Auntie Esther can recover very soon. Godspeed. Thank you. Thank you for your participation too, members of the audience. Thank you. Here we have the ways to contact us icon. So if you have more questions, you can either send them by email at iconproject.org, icon.support@upc.ca, or Facebook and other media. And we also want to thank the Ministry of Health, the BC Ministry of Health Patients as Partners Initiative for their continuing support. So after we have listened to the presentations, we have acquired a lot of knowledge about stroke. Stroke is preventable, it is recoverable, and it is curable. So now we have imparted knowledge in the community so that they can reduce the risk of suffering these critical illnesses. I hope that you can spread the information to other people, and you can also view these presentations again in future after they have been posted. So I hope you enjoy a healthy and happy life. Thank you. Bye-bye.